So I want to thank you all for attending my talk today in this new virtual format. I'm Dr. DeAnn Lazovich. I'm a cancer researcher at the University of Minnesota, and I'm a member of the 10,000 Family Study Research Team, which is the sponsor of today's presentation. So today I'd like to share information with you about cancer in rural and urban Minnesota. This work is based on data collected by the state of Minnesota on cancers and cancer deaths, and also on a statewide survey that was conducted by the Masonic Cancer Center at the University of Minnesota. Before I get started, I would just like to share a word with you from my colleague, Dr. Jen Pointer.
Hello, I'm one of the 10,000 Families investigators and a researcher who studies why children develop cancer. I was born in the small town of Carlstein, Minnesota, which is in the northwest corner of the state, 30 miles from Canada and 30 miles from North Dakota. My dad was a wildlife biologist who worked for the DNR, and I have many fond memories as a child of canoeing, swimming in the lakes, and running and exploring in the wide open spaces. As a fellow Minnesotan, I'd like to warmly welcome you and your family members to participate with us in the 10,000 Family Study. You can learn more about the study by attending our virtual booth at this event and also by checking out our website. Thanks, and have a great day.
Thank you, Jen. So let's start with the definition of rural and urban regions in the US. Groups disagree on the best way to classify these regions. And on this slide, you see Minnesota divided into urban, rural, large town, and small, let's see, let me find my cursor here. Urban, rural, large town, and small town areas. So this takes all 1,300 census tracts, and based on population size, density, and daily commuting, this is one way to look at the urban-rural split within the state of Minnesota. By using this grouping, we have 8% of Minnesotans who live in rural areas, 7% in small towns, 11% in large towns, and 73% in rural areas. In urban areas, 79% of the population is non-Hispanic white. And then that's something less, let's see the pointer. Nope, sorry. Trying to multitask here with all these different techniques. So you have the, in urban areas, again, 79% of the population is non-Hispanic white, but in small towns and rural areas, more than 90% of the population is non-Hispanic white. And in addition, 89% of all immigrants live in urban areas in the state. On this bar in the next few slides, the green bars represent rural and the blue bars represent urban populations residing in Minnesota. Overall, cancer rates are slightly lower for men and women in rural areas compared to urban areas. And this slide shows that cancer rates affect race and ethnic groups in urban and rural areas to different degrees. In particular, the American Indian population experiences a disproportionate burden of cancer regardless of geography or gender. And these are the top 10 cancers diagnosed in men and women by geography. Men living in rural areas are more likely than men in urban areas to experience kidney cancer, colorectal cancer, and lung cancer, but they're about the same likelihood in the two areas to experience prostate cancer. So it's, and women then in rural areas, they're also more likely to experience kidney cancer, colorectal cancer, and breast cancer. So it's important to note that some of these cancers can be reduced by changes in lifestyle and or regular cancer screening. And while new cancers occur slightly less frequently among rural than urban Minnesotans, the cancer death rate is actually higher for rural than urban residents. And this figure shows the most common cancer deaths in men and women by geography. So men in rural areas are slightly more likely to die of colorectal cancer, prostate cancer, and lung cancer. whereas women in rural compared to urban areas are more likely to die of leukemia, colorectal cancer, and breast cancer. It's important to note that there are screening tests that can reduce the risk of death from colorectal, breast, and lung cancers. So higher death rates for these cancers may indicate that individuals in rural areas are less likely to be screened than Minnesotans living in urban areas. It's also possible that rural residents with cancer may have greater difficulty than urban residents accessing cancer treatments due to distance to a clinic or to cost. And here we show some differences between Minnesotans in rural and urban areas for factors that may increase the risk of developing or dying from cancer. So compared to urban populations, we see that rural residents tend to experience somewhat more obesity and are also more likely to smoke. And these are known risk factors. Obesity, for example, is a risk factor for colorectal cancer. Smoking is a well-known risk factor for lung cancer, but other cancers as well. We also find that women in rural areas are less likely to get cervical cancer, or less likely to be screened for cervical cancer, and also less likely, overall residents in rural compared to urban areas are less likely to be screened for lung cancer. And then if we look at factors that actually can decrease the risk of cancer, we also find differences in rural and urban areas. So rural residents report actually being more likely to get screened for colorectal cancer than rural areas. And that's a positive action. Colorectal cancer screening can both prevent cancer if polyps are found and removed, or it can reduce death if the cancer is found early by screening. And women in rural areas report being more likely to get screened for breast cancer than their urban counterparts. It's interesting in light of the fact that breast cancer deaths are higher among rural than urban women. I think this finding from our survey bears further investigation. It could be that although screening is higher in rural areas for breast cancer, that access to breast cancer treatment is more limited. Or it could be that the results from our survey are not entirely accurate because it's a sample of the population while the cancer rates are available for all Minnesotans. So that could be a reason for the discrepancies we see there. So research is a really important way that we learn about how to prevent cancer and cancer deaths. And we wanted to know if opinions about cancer research differed by where Minnesotans live, and also what the challenges for participating in research might be. And we found that rural and urban Minnesotans were in very high agreement about the benefits of cancer research. And these views include that research improves future healthcare and services, that research has enough safeguards to protect participants, research can help prevent disease, and also research can help the participants. We also found that rural residents face some unique challenges to participate in research, primarily due to the lack of research availability in the areas where they receive care, and also getting to a study location where research might be going on. It could be more complicated. So now I'd like to just take this opportunity to tell you a little bit about the 10,000 families study that we're conducting at the University of Minnesota. This is a new research opportunity for you and your community. Its goal is to understand the influence of genetics, lifestyle, and environment on health and illness. The study is seeking to enroll at least 2 family members of any age, but the more the better, and follow them over time to observe good or bad health outcomes. One key feature of the study is that many of the study procedures can be done online, so it doesn't matter where you live. First, one adult family member completes an eligibility survey, and then and this can be done online, and then if eligible, the study sends an invitation to that person to invite other family members to participate. Once there's an eligible family with 2 or more individuals, everyone completes a detailed online health questionnaire for themselves or for their children if they've enrolled their children in the study. And then everyone gets to take part in a family health visit where we do a variety of in-person physical and biological measurements. So that's the only in-person requirement is for these measurements, while everything else can be done online. This step is not surprisingly on hold because of COVID-19. And we're currently exploring ways to do a portion of these visits over Zoom and to continue to collect the data that's so important for the research that we're conducting. So even though the health visits are on hold, we really want to encourage everyone to start the eligibility and data collection process, because someday we will be on the other side of this pandemic. And now I'd like to give the last word from my colleague, Dr. Heather Nelson.
Greetings from Becker County and Big Cormorant Lake, where I spent all of my childhood summers. My name is Heather Nelson, and I am one of the study investigators for 10,000 Families, and I grew up here in northern Minnesota in an extension family, and I know how important it is to include all Minnesotans in our research projects. I hope you'll come and visit our booth and website, and most importantly, join our study to understand how the health of all Minnesotans are impacted by our environment and our genetics and the events of the world.
Okay, thank you, Heather. So here is our email address and a link to the 10,000 Family Study website where you can get more details on the study and complete the eligibility survey. We sure hope to hear from you soon, and I really appreciate your attendance today. Thank you.
Thank you so much, DeAnn, for that presentation. We were excited to have you all in person last year at Farm Fest, and I know that UMass really is appreciative of the fact that rural families and communities are included, and really you're really intentional about getting a representative bunch of families. So that's fantastic. But yeah, this was a great presentation. For a number of folks, in farming communities, we had a presentation this morning about doing preventative healthcare visits. Is that one of the best ways for folks to stay on top of, some of the cancers that you talked about, or are there other steps that folks should be taking?
Are you asking the whole panel or me specifically?
Just you, DeAnn, just you.
Just me. I think it's important to follow the U.S. Preventive Services Task Force guidelines for cancer screenings. Those start at different ages depending on the type of cancer. So individuals at risk for cervical cancer, the screening starts at early age, like 21. For other cancers like colorectal cancer, lung cancer, breast cancer, they tend to start at age 50. So I think and lung cancer screening is actually restricted only to smokers or former smokers, but also starts in the 50s. So I think following through with screening tests that we know can either prevent cancer or reduce the risk of dying from cancer is really important. And that obviously involves seeing a doctor. I think beyond screening, having a regular check-in with the doctor, especially if you see anything unusual, notice anything unusual, is really important, because we don't have screening for all cancers. And so something could come up that it would be important to bring to the attention of one's doctor. But in addition to screening, there are many lifestyle changes that we could, take on that would reduce our risk. Maintaining a healthy weight, having regular physical activity, not smoking, reducing risk of alcohol, reducing sun exposure. So we do have a lot of control, to the extent possible that's not genetically driven. Some cancers, people are predisposed genetically, and that's a little bit harder to change via lifestyle, of course. But I think that these risk factors, these lifestyle factors, we know now people could implement and reduce their risk of cancer.
Yeah, that's a great answer. I'll echo the end of the presentation. I would encourage folks to check out the 10,000 Family Study Expo booth. They have a lot of the information that DeAnn covered in her presentation today. So how to get involved, how to, get to that initial survey and read a little bit more about it. So that link is in the chat, and I would encourage folks to go ahead and visit that booth. But a big thank you to you, DeAnn. Thank you for being a part of the expo today and your time.
All right. Thank you.